My name is Shaji Kumar. I am at Mayo Clinic in Rochester. I am here at the ASCO 2015 meeting in Chicago. Right, so this is a phase 1-2 trial that we are currently doing with a drug called Venetoclax or ABT-199. Now this is one of the designer molecules that's specifically targeted towards inhibition of BCL2. Now BCL2 is an anti-apoptotic protein that helps cancer cells survive, and we know it also is relevant in multiple myeloma. So we had done some preclinical work showing that this inhibition of BCL2 using this class of drugs does have the ability to kill myeloma cells. So this was a logical early phase trial to be done with this drug. So the one I'm presenting at the meeting is the single agent trial, which is looking at the maximum tolerated dose of ABT-199 or Venetoclax in patients with relapsed multiple myeloma. So the study is a dose escalation trial. So we had patients with relapsed refractory disease go on therapy with the trial. They are enrolled on the trial, then they started on a lower dose of Venetoclax for a week, then another week of lead-in with a slightly higher dose, and finally they reached the dose which they are supposed to. The reason for doing that is because there was some concern whether we would see tumor lysis like what has been seen in chronic lymphocytic leukemia. So far, we have enrolled a total of 29 patients on the trial. We have not seen any tumor lysis. We have not seen any significant problems. Now, out of the 29 patients who have gone on the study, we have reached the maximum tolerated dose of 1200 milligrams daily. The toxicities that we have seen has predominantly been hematologic. We have seen some drop in the platelet counts and neutrophils. The other main group of side effects has been gastrointestinal. But all the side effects are well managed with the dose reductions, so that has not been a problem. In terms of efficacy, we actually saw 2 patients who had a complete response to treatment, and both these patients had translocation 1114. Now, based on the preclinical studies, we had sort of predicted that this would be the group of patients who would be benefited the most with this particular drug, and the clinical trial result seems to bear that out. So out of the 11 patients with 1114 translocations, 2 patients had a complete response. 1 patient had a minimal response, and these complete responses have been ongoing now for several months. So I think it's really proof of principle in a particular genetic category of patients that this drug might be particularly effective. And from a biological standpoint, we think the 1114 patients have a high levels of BCL2 and low levels of MCL1. The MCL1 being the mechanism of resistance to BCL2 inhibition. So I think the results are very encouraging, considering that this is a group of patients with a median of 6 prior lines of therapy. So if heavily pretreated patients, almost everybody, over 80% of these patients had seen bortezomib and lenalidomide. 2/3 have had a transplant, and about 1/3 of them were refractory to both bortezomib and lenalidomide. So I think it's a small number, but I think the early result seems very encouraging. So I think we feel optimistic about it going forward, particularly in the patients with 1114 translocation. So this might be an example of a first genetically grouped patient treatment strategy. Right. So our diagnosis about 20% of patients. So these are patients who do have more. I wouldn't say chronic, but when you look at relapsed patient population, it might be a little bit more. Yeah, we'll continue with the expansion phase, so the phase 1 trial, and then we have to decide what would be the next step. There's also a parallel ongoing trial that's looking at ABT-199 in combination with bortezomib, and that is also currently accruing. So I think the main message is now we have a new class of drug, a new mechanism that's being pursued that's showing promise. So yes, this drug may be only effective for the 1114 patients, but even if that's true, it's still a substantial improvement in the field overall.